What's up, guys? This is Dr. Meghan Wieser, physio coach at Recharge. This is episode 7 of Should I Feel Strongly About? This one may feel like it's coming out of left field, but it's something that's kind of always been on my mind. It's why I moved from New Jersey to Maryland to work at Recharge. But I guess as a blanket statement, not all physical therapy is created equal. So I wanted to talk about this because more recently it was I had a case where this woman had longstanding pain for like 8-9 years or something like that, and has been through physical therapy multiple times without much success. So her pain has gotten worse and worse and worse to the point where she's talking with surgeons, and yeah, stuff like that. That's basically the story with that. And there's so many cases like that I've come across. People have been to PT this many times, like, oh, I've done PT already, it doesn't work. But not all PT or not all physical therapy is the same. And not all physical therapy can really be considered skilled physical therapy. So what this woman had went through was lots of like heat, electrical stim, ultrasound. The therapist pet her neck for a little while and then sent her on her way, and she was doing that 3 times a week for whatever. And I did that multiple times. Well, no shit, that didn't work. And there's a lot of cases like this out there. I'm sure you or somebody you know has had that issue before. You've been to PT and you haven't gotten better, and it's because it wasn't actually skilled PT. I'm sure someone you know out there, or maybe you yourself, have experienced some level of pain or ache, and it's persisted beyond what you think is appropriate or is okay for you based on your daily life and the demands of your life. And there's a lot of people out there that I think have had a bad experience with physical therapy because they haven't actually received the level of care that they should. Whether that be interpersonally, because the system is not necessarily built for an appropriate level of care, or just because the person was either overdosed or underdosed and they saw no progress with their pain or their injury. And it's kind of a problem, and some of this is to no fault of the therapist. The system is set up kind of idiotically for that realm of care, right? So you've probably had PT before. You go into an office and your therapist is seeing you plus 2, 3, 4 other people at the same time. So there's not as much one-on-one care, but the reason that is set up that way is because reimbursement rates for PT are very low and continuing to decline. So the only way that the clinic can make a profit is if they see more patients, which means overbooking the therapist, which means less one-on-one time with patients, which means subpar care, so on and so forth. And not everywhere is set up that way. That does not have to be the case. There are more and more clinics and therapists popping up everywhere who are realizing that this is not why we got into being physical therapists. So that's not your only choice. There's better out there. There are good and bad PTs out there. There are good and bad chiros out there. There are good and bad physicians out there, etc. We know all that. I'm not talking about the specifics of the therapist, but the environment. So not every PT clinic is set up so that you're being seen with 4 other people at the same time, and somebody's petting your neck and slapping a heat pack on it and calling that skilled PT, because that is not skilled PT. Walk right out of there. So there are a lot of issues with this, which we probably won't have time for today. But a couple top of mind. There's a lot of issues with the system and with how that type of PT is run, and why you or your friends or whoever has been through this probably hasn't seen results from PT. So, you know, there's skilled PT, there's not skilled PT, and obviously pain is very complex. So there's a lot of layers to it, right? So my first issue being, you'll see a lot of fear-mongering statements out there. You'll see this in the fitness industry as well, but for specifics today, physical therapy themselves, So like fear-mongering statements, meaning like instilling fear in a person because if they do whatever movement, it's going to mean they're going to break something or damage something or whatever. So like examples, don't squat with your knees going over your toes because your kneecaps will blow out. Don't bend forward if you have disc issues because your discs will explode out the back of your back. They don't use, I'm exaggerating, right? Like that's, no one actually says that to patients, but that's how patients interpret it, right? Like when you're instructing people on movement, this goes back to another episode that I did. When you're instructing people on movement, there tends to be this dichotomy, I think, and this just paradigm where this is the right way to do things for your back. This is the right way to do things for your shoulder. This is the right way. You should, like, it's almost like robotic in a way. And so when exercises are prescribed or coached by certain PTs or even, fitness professionals, they're tagging along with those exercises with some statements that are saying like, oh, don't do this because that's really bad for your knees, or that's really bad for your back, or that's really bad for your shoulders. If you're trying to get somebody to move more, you shouldn't be attaching those statements and those instructions with ways that are or statements that are going to probably deter them from wanting to move more or make them afraid to do things. My next issue with not great PT versus really good PT is that there's often an emphasis on this side of the spectrum with like anatomy or pathoanatomical diagnoses. That's a really big word that just means anatomy and physiology. So like just looking at your body as a structure or a mechanical thing, not looking at you as a human. So we know now through research and probably anecdotally too that pain and injury is so complex. I could have the same exact imaging findings on my shoulder as someone sitting right next to me. It could have happened the same exact way, same mechanism of injury, same time of day, same load, whatever. And our rehab is going to be very different because we're two different people with two different social lives, with two different emotional states, with two different previous experiences in the context of injury and in the context of shoulders and stuff like that. So there's a heavy focus on this is the structure that's causing the issue, therefore we need to do these exercises, or therefore you need to avoid these exercises. So there's a heavy emphasis on just the body being flawed or screwed up without taking into account like the psychological aspects of things or even the social aspects of things. It's looking at the person as a whole, because we know, and this is like fact, this isn't opinion anymore. We know via research that pain can be influenced and determined even by your mechanism of injury and your mindset at that time of injury, your previous experiences, and even down to like sleep and nutrition and stuff like that. So a good PT will take that into account. You should be getting questions about how you're sleeping. What's your social life been like? What's different over the past 3 weeks? Like what has changed? You should be getting questions not based on just the mechanism of injury, if there was a mechanism, or just that body part. You are a human and you should be treated as such. I think in most cases, when people get sent off to physical therapy, they are underdosed and underloaded. We are humans. We are built to move, okay? The only way that your tissues are going to improve or exceed their prior level of capacity, their injured state of capacity, is to challenge that capacity. So we need to load our patients better. This section, I've been referring to this as the not so great section the whole time here. This section needs to learn to start loading your patients. You should be challenged in physical therapy. And I don't mean challenged like in a no pain, no gain sense, right? Like there are times when pushing into some level of symptoms is probably appropriate. There are other times when you should not feel like hell. I feel like you should always not feel like hell. You should be challenged and you should be using weight during physical therapy. That's what's going to get you better. That is what is going to allow for some physiological tissue adaptation. That's what's going to get you stronger, more resilient, more fit. And that's really what we're looking for with PT, right? Like, we want to improve the symptoms, but also get you either back to or exceeding your prior level of function so that this doesn't happen again. And improve that will, like, thereby improve your quality of life overall. My next point is there is an overuse of modalities in physical therapy. Why we have not moved past this, I don't understand. Actually, no, I do understand it. They're time fillers. They are time fillers because PTs are overbooked. Going back to reimbursement rates declining, PTs, we need to see more patients. PTs are overbooked. So you don't have 3 different brains to work with 3 different patients at the same time. These modalities, and when I say modalities, I mean like heat, ice, ultrasound, electrical stimulation, things that don't involve you working or the therapist helping you with something, either tactilely, visually, whatever. And they're essentially time fillers. There are cases where some of these are warranted. Yes, I'm sure. But a broad stroke here, these things are overused and they are a waste of time and they are not actually going to get you better. You can use ice and heat, use them. You can do that at home. You don't need to go to therapy for that. That is not skilled PT. We need to step away from passive treatment and calling that skilled PT, which I think plays into why reimbursements rates are declining. But anyway, and more into active treatment, challenging our patients, getting a look at them as looking at you as a whole person, challenging you appropriately, and monitoring load and symptoms and just managing everything appropriately. In an ideal world, your care should be collaborative, not only between you and your therapist, but between your physician, your chiropractor, if you're seeing them, with your personal trainer, if you're seeing them, with your coach. These people should all be involved in your care with regard to your injury or your pain or whatever. That's not always feasible right now, right? But that also goes, like, your therapist should still respect the opinions of your other healthcare providers. That doesn't mean they have to agree with them, but they should at least acknowledge their opinions and explain to you what their mindset might be or where their thought process is going, if they agree or if they don't agree. There's cases when your physical therapist will probably know better than what those other clinicians would know, or would give you a better idea as to what decisions to make for certain circumstances. Those other clinicians or those other healthcare people in your life are essentially their colleagues, right? Like, everybody wants you to get better. That's the same goal. Anybody who puts down another fitness professional or another healthcare professional or whatever is kind of a yellow, orange, red flag to me, depending on the case. Lastly, well, there's probably more, but lastly for today, I feel like there's a generic physical therapy referral in terms of frequency and duration. And it's always said when I worked for a hospital system and for other clinics and stuff before, it's always said physical therapy 3 times a week for 8 to 12 weeks. That's a long ass time. And it would be for something who maybe I would need to see that person for 2 solid visits, like 2 good visits, right? Not the 2 visits where you get 10 minutes of seeing your therapist and then they move on to somebody else. So 3 times per week for 8 to 12 weeks is bonkers. I would argue that there is almost nothing that needs that much stimulus. Now I'm talking in like the orthopedic sports realm, that kind of thing. There are certainly cases where somebody needs that much input and that much stimulus. But again, broad strokes here, generally speaking, you don't need to be seen that many times per week. You should leave your first session having a good idea as to what your plan is, at least for what you need to be doing on your side of the recovery, um, for at least the next until at least the next session, right? Like you should leave your first session knowing what you need to do and what things should feel like and what things should look like until the next time you see your therapist, at the very least, because there's a lot of factors and unknowns that can pop up. So there's no way you're going to know exactly what your 6 weeks of rehab is going to look like, or your 4 weeks, or your 2 weeks, or whatever. But you should have a good idea as to what you can do to help yourself, what your therapist can do to help yourself, and what's going on. Like at least some kind of speculation or some kind of thought process. You should be informed about what is going on with your body. And I think having some level of understanding also goes into how well you recover, or how quickly you recover, or your mindset when you're recovering. Not all PT is created equal. There are a lot of places out there now that you're not going to see people 3 times a week for 8 to 12 weeks. You're going to see somebody maybe once a week for 3 weeks, 4 weeks, maybe once every other week for a month or so, with a check-in at the end of the year or something. That's possible. There are things out there. So if you're concerned financially, time commitment wise, whatever, there are other options. They exist, I promise. We're one of them. Share this video far and wide, especially with the people who have been to physical therapy or need physical therapy in your life. And hit subscribe if you want to see more of this. I'll see you guys next time.